Okay, guys, we're on chapter 25. This is fluid, electrolyte, and acid base balance. I think that as we go through the course, some of the chapters get more challenging, and a lot of it does have to do more with your independent studies. So sometimes the slides are not enough. That is just the nature of how nursing school is. So if at any point you're following along with the slides and you are just genuinely confused or you feel like you need more information, it just is your responsibility to pause and go look it up. Use your SurePath AI. Go watch a video on YouTube. That's the best way that you can be proactive in your learning. That way that you're not confused. And yeah, it's just part of how it is in nursing school. And it's just how it is as a nurse. When I'm a nurse, I have to look up a bunch of things that I'm unfamiliar with. You're never going to know everything. That's okay. But it's up to you to take about accountability and make sure that you are looking everything up that you don't know. And as I said, it's normal not to know everything, but it's not normal to just keep going if you don't know it. You have to pause and tell yourself that that's something you need to look into. So I'm going to move along. You're going to pause and read this. Pause and read this as well. Composition of body fluids. So the two largest constituents, of the body are water and electrolytes. Water is more than half of the body's weight. And electrolytes, these are minerals or salts dissolved in body fluids. In solution, they break up into ions. So, how long would humans survive without food? Typically about 1 week, but there have been some documented instances of some longer periods. And how long would a human survive without water? It's only actually 2 to 3 days. It's not that long. So, water serves four functions. This is a vehicle for transporting substances to and from cells, aids in heat regulation, assists in um, H plus balance in the body, is a medium for enzymatic action of digestion. Amount varies with age, sex, and health. I'm familiar with H plus. H plus is just referring to hydrogen. Infants and elderly become dehydrated more rapidly. Infants' kidneys reabsorb less fluid. Elderly have less anti-diuretic hormone and diminished thirst sensation. Water is critical to maintaining homeostasis. So on this slide, there are different vocabulary words like anti-diuretic hormone as well as homeostasis. You should know what homeostasis is, but if you didn't know what both of those words were, you need to look those up and familiarize yourself with that. Um, as we age, there is also this loss of thirst sensation. So sometimes you won't realize you're thirsty. That can cause older adults or even middle-aged adults to not realize that they are dehydrated. The kidneys are less efficient with age and especially with most chronic diseases. Sources of water and avenues of loss. So this is important here. Intake, this is what you put into your body and how you gather water from taking something in. So oral intake, there's food intake, metabolism intake, and then your output, there's output areas of urine, perspiration, which is sweating, feces, expired air. And you can see here, there are values that they give you here for what intake can look like, as well as what output can look like for water. It's likely you don't take in this much water daily. So think about how dehydrated most people are walking around. Electrolytes, you need to know these. So there's sodium, which is water regulation and balance. Potassium, nerve impulse transmission, muscle contraction, plasma acid-base balance, calcium, muscle activity, blood coagulation, magnesium, nerve impulse transmission, muscle contraction. Phosphate is ATP production. Chloride, hydrochloric acid production, acid-base balance. Bicarbonate is acid-base balance. So pause and either make flashcards or write these down. If you do not familiarize yourself with this in this course, as I said, the next course that you enter will be MedSurg 1. They'll expect that you already know all of these things. They're not going to go back and teach it. So you want to make sure that you are keeping up right now during fundamentals and foundations because you should have learned the foundations of the course. So make sure you are really paying attention because things will only get more detailed and difficult next course, and they're not going to go over these little things. So these are the normal ranges. Really, you need to memorize these. So as you make your flashcards for these electrolytes, memorize these. These values are important to know. Why are they important to know? Because as a nurse, when any of these electrolytes are out of balance, you will need to make medication adjustments. You'll have to alert the primary care physician, stuff like that. It shows that there is an illness or an alteration in the body or something that is missing or something that is too excessive in the body. So every nurse needs to know how to interpret these, just like vital signs. So you got to pause in, you got to memorize these. So there's, of course, age-related differences between infants, children's, adults, but here's normal age range for adults. So we will focus on that for now. There are non-electrolytes, amino acids, which are proteins, glucose, and fatty acids, remain bound together when dissolved in body fluid. In the healthy individual who is eating normally, non-electrolytes are circulating in the body fluid and they are remaining stable. Blood, normal circulating blood volume is 4 to 6 liters. This is composed of erythrocytes, which are red cells, leukocytes, which are white cells. Platelets are thrombocytes, and they are carried in the plasma. So you need to know normal circulating blood volume is 4 to 6 liters. A lot of this chapter, I think, is going to be lots of memorization. So it is your responsibility to pause and do this. You also need to be able to understand what erythrocytes, leukocytes, and platelets are. Okay. Plasma proteins and colloids contribute to plasma osmotic pressure, which keeps fluid in the vascular compartment. Anything that alters body fluid volume also alters plasma volume. Plasma volume can affect blood pressure. Plasma volume can affect circulation. So with increased plasma volume, would you think that blood pressure is usually high or is it low? So take a second and think about that. The same thing with is the pulse usually fast or slow if you have increased plasma volume. So an increased plasma volume, that means that there's more fluid in the blood vessels. That means that your blood pressure would be high, and your pulse would actually be slow or sometimes normal. Why would pulse be slow? It's because there are these baroreceptors that sense high pressure and they activate the parasympathetic vagal response, which creates your heart to have a rate that decreases to compensate. And then with decreased plasma volume, so less fluid in the blood vessels, you would see low blood pressure, sorry guys, and that you would see a compensation of the pulse going faster. Some of you guys, might not be familiar with these concepts. They are tricky, especially if you have not been in school for a while or you're not familiar with, nursing style topics. So as I keep trying to mention, some of these things are things that you just have to look up and you have to search up how you can understand this in a way that makes sense to you. Because it might not be easy to grasp, reading it from this slide. Distribution of body fluids. So body fluids are intracellular. So intra means within or in. So intracellular, within the cell. Then extracellular, extra means outside or beyond. So extracellular would mean outside the cell. So within extracellular, you will see intravascular, interstitial, and transcellular. There are three compartments of the extracellular space, which is what I just mentioned. Um, Familiarize yourself also with those terms, but I'm about to go over them. So extracellular fluid, this makes up approximately 1/3 of the total body water. This transports nutrients, oxygen, and waste products to and from cells. This is regulated by renal, metabolic, and neurologic factors. It's high in sodium content. So sodium is an extracellular fluid. So think about how you would review also normal sodium lab values. You want to know what those values are as well. Intravascular fluid, the fluid within the blood vessels, consists of plasma and fluid within the blood cells, contains large amount of protein and electrolytes, which help maintain intravascular volume. So serum studies for electrolytes, blood components are drawn from this space, so from your blood vessels. Intravascular space may be either arterial, which is arterial blood gases, or venous. Transcellular fluids, aqueous humor in the eyes, saliva, cerebrospinal fluid, pleural, peritoneal, synovial, and pericardial fluids, gastrointestinal secretions, fluid in the urinary tract, lymphatic system fluids. These are body fluids with unique compositions. What can these fluids be tested for? You can test these for glucose, protein, white blood cells, red blood cells, bacteria, malignant cells, which means cancerous cells, as well as pH. So if you're not familiar with any of the vocabulary on this slide, you just look it up and say, what is a basic definition that I can understand of, and whatever word you do not understand on the slide. Movement of fluids and electrolytes, water taken in by ingesting fluids and food and through metabolism. Thirst mechanism in the hypothalamus regulates thirst based on concentration of electrolytes and solutes in circulation. Kidney is the main organ of water secretion, with some loss in feces, perspiration, and breathing. Water retention based on aldosterone levels, antidiuretic hormone, ADH levels, and natriuretic peptide levels. So you want to definitely remember too that kidney is the main organ of water secretion. The content of fluids administered for intake can affect the metabolism. So PO, which is by mouth, water for fluid volume, ADH regulation, IV, glucose, lipids, electrolytes, central venous access catheters, medications like antibiotics, chemotherapy, enteral or tube feedings complete nutritional requirements, but they may cause diarrhea. Cavity installation, peritoneal lavage or lavage, electrolytes to move fluids across the tissue membranes. Fluid electrolyte and nutrient transport mechanisms, diffusion, passive transport. Process by which substances move back and forth across the membrane until evenly distributed throughout the available space. Substances move from high to low concentration until concentration on both sides of the membrane is equal. So if there are, or if there is a high concentration, it's going to move towards where the area is lowly concentrated so that it's equal in the membrane. Glucose, oxygen, carbon dioxide, water, and other small ions and molecules move by diffusion. Diffusion. This is the process by which substances, like I said, it moves back and forth across the membrane until they are evenly distributed through the available space. It's moving from high to low so that it equalizes. And we're going to see a picture next about what diffusion looks like. So you'll pause and just take a look at it. Fluid, electrolyte, and nutrient transport mechanisms. Osmosis. This is passive transport. Movement of pure solvent, liquid, across a membrane. Water moves from area of less solute concentration to area of greater concentration until the solutions in the compartments are of equal concentration. Takes place via a semi-permeable membrane. So if you don't know what semi-permeable membrane means, you have to look it up, but I will tell you here. It's a membrane that allows some substances to pass through, but it prevents the passage of other substances. So semi means somewhat or not completely. Um, so always look at also prefixes of your vocab. It'll help you understand different parts of vocabulary. So here you want to pause and take a look at the diagram. If I'm ever telling you to pause and I'm flipping through the slide, that means you should be pausing. I'm flipping so that the lecture does not last hours and hours, but you're supposed to be pausing when I'm telling you to pause. So look at the diagram here. You're seeing that molecules are moving from lesser concentration to get greater concentration. Um, so filtration, this is also passive transport. Movement of water and suspended substances outward through a semi-permeable membrane. Hydrostatic pressure causes fluid to press outward on the vessel. The force promotes filtration, forcing movement of water and electrolytes through the capillary wall to the interstitial fluid. The heart creates a hydrostatic pressure within the capillaries. So that's something you want to know. As I said, I mean, a lot of these concepts are a little bit advanced, I think. So you will just need to make flashcards to make sure you understand these parts because it's hard to grasp if you're only hearing this once. This is what filtration looks like. So take a second to pause. Filtration is the movement of molecules between a semi-permeable capillary membrane. Active transport requires cellular energy. This can move molecules into cells regardless of their electrical charge or the concentrations already in the cell. The energy source for the process is adenosine triphosphate, which is called ATP. Can move amino acids, glucose, iron, hydrogen, sodium, potassium, and calcium through the cell membrane. How is ATP produced? It's produced during the complex metabolic processes in the body cells. So you'll see active transport next. Pause and take a look. Fluid volume deficit at risk. Patients unable to take in enough fluid, impaired swallowing, extreme weakness, disorientation or coma, or unavailability of water. Patients who lose excessive amounts of fluid, so someone who is vomiting a lot, diarrhea, hemorrhage, diaphoresis, which is sweating, or excessive wound drainage. Result is dehydration. So it's really important that you take note of this slide as well. You want to think about who would be at risk for fluid volume deficit. It has the examples right there, so write them down. Dehydration. This is when too little water is in the plasma, water drawn out of the cells by osmosis to equalize concentration, and the cells shrivel, treated by fluid administration, either orally or intravenously. So make sure that you guys are familiar with the word plasma. Please do not go past any slide without understanding what anything means. It is only going to get complicated as we keep going further. So triggers for these symptoms, decreased plasma volume or increased production of ADH. Why is increased production of ADH a compensatory response? So when volume is decreased, urine output will be decreased. So if you do not have enough volume, you're not going to have greater urinary output. How is tissue turgor checked? So tissue turgor, this is the degree of elasticity. This is checked by gently pinching up the skin over the abdomen, forearm, sternum, forehead, thigh. This is done in a person with normal fluid balance. Um, the pinched skin would immediately fall back if they were at a normal fluid balance. If it's done in a fluid deficit person, the skin may remain elevated or tented looking, so it looks like a tent, for several seconds after you pinch. So some of you guys may have seen this already, those that are working in the healthcare facilities. But this is how you check for dehydration. So signs and symptoms of dehydration, you want to pause and make sure that you know the signs and symptoms because this is how your test questions will likely present. So take a note of these. I'm not going to read them, just take a note and write them down. Why would a pulse rate increase? This is because of decreased fluid and plasma volume. Elevated temperatures, usually due to dehydration stimulation of the inflammatory response. And then think about your own personal experiences with dehydration. We've all experienced dehydration at some point. I currently am experiencing it because I have the flu right now. And I have had a fever over the last 2 days. So the inflammatory response was activated. I was sweating a lot, so losing fluid like that. And I have had many of these symptoms like dry lips, dry mucous membranes, nostrils are very dry, skin on my face is very dry. My pulse rate has been high, stuff like that. So you will see these, and you guys have definitely experienced this already. So, on the other hand, fluid volume excess. Healthy people do not ordinarily drink too much water. So, this is not typically because you have drank too much water. When people become ill, they may take in more water than they excrete. Receive intravenous fluid too quickly. So, that is also how you can have fluid volume excess. Given tap water enemas or drink more fluids than they can eliminate. Um, Signs of overhydration, weight gain. So sometimes that's why you will see heart patients, they get daily weight. This is to see if fluid volume has been increased. You will also see crackles in the lungs. These crackles are showing fluid in the lungs, wet lungs. You also see slow bounding pulse. If you're unfamiliar with a bounding pulse, you need to look that up. Elevated blood pressure, you need to apply and understand why or what does it mean with fluid and blood pressure. If you see elevated blood pressure, what does that mean about fluid? If you see decreased blood pressure, what does that mean about fluid? Also, possibly edema. Because plasma volume is increased, ADH will be decreased to help facilitate increased urinary output. If you're not familiar with ADH, please pause and look that up, write it down. Why is blood pressure increased and the heart rate decreased? So increased fluid plasma volume. That's why. So this is an example of pitting edema. It looks like a balloon. Um, If you push your fingers in, it causes a indentation and it remains. So it looks like that. Um, Electrolyte imbalance, sodium. So hyponatremia. So hypo means below. Sodium deficit can be found from decreased sodium or increased water intake and retention. May be caused by excessive excessive vomiting or diarrhea. Then we have hypernatremia. Sodium excess, most commonly from water loss from fever or respiratory infection. So signs and symptoms, please write this down. Of hyponatremia, you would see altered LOC, anxiety, nausea, vomiting. With hypernatremia, you will see dry mucous membrane, thirst, weakness, and lethargy. Electrolyte imbalance, potassium, hypokalemia. So occurs when there is excess potassium or loss of body water. May be from poor diet, vomiting, diarrhea, excessive sweating, or diuretic therapy. Hyperkalemia occurs with burn, crush injuries, uncontrolled diabetes mellitus, and renal failure. Signs and symptoms of hypokalemia, please make sure you know these, which is abdominal pain, cardiac dysrhythmia, paralytic ileus, which is decreased bowel sounds, and you will see increased urine pH. Hyperkalemia, signs and symptoms is weakness, lethargy, paralysis, hypotension, and you will see ECG changes. Electrolyte imbalance, calcium, hypocalcemia. This occurs with nutritional deficiency of calcium or vitamin D, or in bone disorders such as metastatic cancer of the bone. And we have hypercalcemia, most cases related to hyperparathyroidism or malignancy such as multiple myeloma, sorry. So hypocalcemia, how will we know what the signs and symptoms are? This is a positive um, Chvostek's sign. It's spelled CH.25-Fluid sign. Paresthesias, seizures, wheezing, swallowing problems. And then for hypercalcemia, you will see anorexia, abdominal pain, renal calculi, and fractures due to bone loss. Electrolyte imbalance, calcium. So hypocalcemia. Calcium levels drop below 8.4 milligrams of deciliter. You will need to know that can occur from nutritional deficiency of calcium or vitamin D, occurs in disorders in which there is a shift of calcium in the bone, calcium, hypercalcemia, calcium level above 10.6 milligrams over deciliter. Most cases are related to hyperparathyroidism or malignancy in which there is metastasis with bone reabsorption. So these look like almost the same slide. I don't know why they had to repeat. Now we have magnesium, hypomagnesemia, results from malabsorption, malnutrition, renal tubular dysfunction, thiazide diuretic use, extensive gastric suction, or diarrhea. Hypermagnesemia occurs only in presence of renal failure. So same with hypomagnesemia. This is the positive Chvostek sign, which is includes twitching. Hypocalcemia, hypokalemia, both are seen. And then in magnesemia, you see hypotension, nausea, vomiting, paralysis, respiratory depression, ECG changes. So Kimberly's patient is on a strict intake and output measurement. Her patient's total output is 2,200 milliliters. What should be the total, what should the total be for an average adult? So pause and think about it. An average output for an adult is 2,400 milliliters. If Kimberly's patient has an output of 2,200 milliliters, this would be considered within normal limits. Number two, the predominant electrolyte in extracellular fluid is blank, and the predominant electrolyte in intracellular fluid is blank. So pause. Once you come back, the answer is number three. Sodium is the predominant electrolyte in the extracellular fluid. Potassium is the predominant electrolyte in the intracellular fluid. So you will need to be familiar with all of these guys. Amanda's patient is going home from the hospital. Her patient has a history of congestive heart failure. She includes in her discharge teaching for the patient to weigh herself. So take a look and pause and think about the answer. The answer here is number two. So tracking daily weight is one way to assess for any changes in the fluid balance. Weight is measured when it's measured at the same time every morning in the same clothes on the same scale. Number four, after Amanda's patient goes home, she notices her rings are tighter around her fingers. She has gained 5 pounds in 2 days. She is experiencing fluid overload. In fluid overload, a patient's vital signs change. Which of the following might be anticipated regarding blood pressure? So, guys, you really need to understand the association between fluid balance and blood pressure. Every nurse needs to know this actually because you will need to understand how to tend to a patient daily, but also in an emergency situation, depending on what their blood pressure is, you might have to administer a certain medication or provide a certain intervention. So it's really important you understand how fluid balance works. Pause and take a look and think about what you would answer here. So the answer here is one. Fluid overload will cause a rise in systolic blood pressure. A bounding pulse is also associated with fluid overload. So pause and take a look and see what you'll need to know. Acid-base balance. This is another tricky concept, so you will need to probably do your own independent studies about these because these concepts are difficult. Acid-base balance is important in maintaining homeostasis. So pH, measure of the degree of acidity or alkalinity. Normal serum pH is 7.35 to 7.45. Death may occur if pH is less than 6.8 or greater than 7.8. Balance between bicarbonate and carbonic acid. Carbonic acid retained or removed by respiratory system. Bicarbonate retained or removed by kidneys. The lungs are a quicker way to compensate. They exhale or blow off carbonic acid. Your kidneys is slower to compensate. Increased concentration of bicarbonate is based on the function of kidney tubules. You will need to know and memorize also the pH value of 7.35 to 7.45. There's not really any wiggle room for this. These numbers are important to maintain compatibility with life. So it's important that you know that. And also, you want to make sure that you understand what bicarbonate and carbonic acid is, but I think the next slide might cover it. If you don't understand it after I go through it, you will need to look it up as I keep trying to repeat. So bicarbonate, the normal range is 22 to 26. You will need to know that absolutely. This acts as a buffer to neutralize excess acids in the body and maintain bicarbonate to carbonic acid ratio at 20 to 1. Kidneys selectively reabsorb or excrete bicarbonate to regulate serum levels and help maintain acid-base balance. So the major function is of this alkaline electrolyte is the regulation of acid-base balance of the body. Bicarbonate acts as a buffer to neutralize the excess acids in the body and maintain the bicarbonate to carbonic acid ratio at 20 to 1, which is needed for homeostasis. Control mechanisms, you have the blood buffer system. This consists of weak acids and weak bases. Lungs, carbon dioxide and water are expired from the lungs. Urinary system, enzymes promote the dissociation of carbonic acid to free hydrogen ions. For the serum pH to remain within the normal range of 7.35 to 7.45, as we said, the rate of bicarbonate ion to carbonic acid must be 20 to 1. If one component of the ratio changes, The other must change proportionately to maintain the proper balance for serum pH to be within the normal range. Acid-base imbalance continued, respiratory acidosis, increased carbon dioxide levels from airway obstruction, pneumonia, asthma, chest injuries, opiate intake, chronic obstructive lung disease. So here you will see there is an excess of acid. Lungs are not able to effectively blow off the carbonic acid. Renal system is not able to fully compensate. You will see PaCO2 is greater than 45 millimeters mercury. This is essential. Respiratory acidosis moves opposite of the serum pH. An elevation of the PaCO2 is acidic. The pH will be decreased below 7.35. This is acidic. The elevated PaCO2 determines this to be respiratory acidosis. Then you have metabolic acidosis, an excessive loss of bicarbonate ions or retention of hydrogen ions caused by kidney disease, diabetic ketoacidosis, circulatory failure, shock states. The PaCO2 is within normal limits. The serum pH is below 7.35. The lungs' capability is not adequate. Patient usually has labored respirations as the lungs attempt to blow off the excess acid, like Kussmaul's respirations with diabetic ketoacidosis. Shock will also cause increased respiratory rate. Bicarbonate level will be below 22. Acid-base imbalance, respiratory alkalosis, usually caused by anxiety, high fever, hyperventilation, salicylate poisoning, so ASA overdose, encephalitis. Hyperventilation is a common cause, also commonly associated with aspirin overdose. Treatment is application of a rebreather mask to mix the CO2 to increase the carbonic acid content of the lungs to regulate the breathing. The PaCO2 is below 35 milligrams of mercury. This is key, and again, opposite of the serum pH. So the serum pH is going to be greater than 7.45. The low PaCO2 determines this to be respiratory alkalosis. For those of you who are unfamiliar with the term PaCO2, this is partial pressure of carbon dioxide in your arterial blood. Acid-base imbalance, metabolic alkalosis, caused by vomiting, gastric suction, excessive antacid consumption, diuretic therapy, potassium deficit. This is the loss of acid commonly caused by gastric suction by NG tube or ingestion of too much baking soda, sodium bicarbonate. Potassium will be decreased. Metabolic acidosis is the serum pH greater than 7.45. The bicarbonate will be greater than 26 MEQ per liter. So Terry's patient is critical. She has poor circulation, uncontrolled diabetes, had history of renal failure, and diarrhea. She is at risk for which acid-base imbalance? You will definitely get questions like this, so you need to familiarize yourself with acid-base imbalance. I do think this is a very tricky concept. So I will try to find maybe a YouTube video, but I do think you should do your independent search to find a video that would make most sense to you, because something that might make sense to me might not make sense to you, but I will post a link as well with this lecture, maybe from YouTube, so that you guys can watch it as well and familiarize yourself as well. But you will get many questions as well on your NCLEX, which I experienced as well, that will ask you similar questions to this, or it will ask or give you data on a patient, and it will ask you what acid-base imbalance they are experiencing. So 100% you have to familiarize yourself with these concepts. So pause and take a look. The answer here is number two, metabolic acidosis. Terry's patient is at high risk for developing metabolic acidosis because of her poor circulation, uncontrolled diabetes, history of renal failure, and diarrhea. These conditions all cause metabolic acidosis. So good luck, guys. Not easy, but that is why these week 6 only had 2 chapters. I think it was intentional because they're difficult material, which will require you to do a lot of independent studies. Good luck, guys.